Hey, you guys, welcome to our final study round from our non clinical series. This week, we've been covering professional topics. And, for this month, I've been doing a series to help y'all retain these. So, my thing is repetition is key to retention. So, as always, I will go over the terms and I will say it to you 3 times. I want you to listen to me say it 3 times. And then you take a moment, pause the video, write it 3 times, and read it out loud 3 times. I know, but trust me, this is going to help. There's a method to my madness. Be sure to do it. And if you are writing and listening, just let it play repetitively. If you're cooking and listening, cleaning and listening, whatever you're doing to help to kind of get this into your mind, just let it play. But when you get home, make sure you're writing these out as you're studying. And one of the times, I talk about the flashcard sheet. So one of your times when you're writing it 3 times can be a part of writing it down on the flashcard sheet. And I'll discuss the flashcard sheet a bit more in a second. But you guys, hey y'all, I always give my disclaimer in my videos to just let y'all know I'm Dr. Brittany Weinstock, a family nurse practitioner and founder and CEO of the Nursing Studio. But these videos are strictly to help nurses and nurse practitioners to be successful in exams and boards in practice. But there's no absolutes in medicine. There's no end all be all. So take this for what it is and apply it as such, okay? Let's get into the terms. So I'm going through these because, as I mentioned before, we know that there's a lot of things that they kind of overlap with these, right? And so I just want you to be able to identify and really be familiar with what separates them so that you know the terms, that you can get them in your mind that way. So we have Board of Nursing. So the Board of Nursing protects the public's health and welfare by assuring that safe and competent nursing care is provided by licensed nurses, and this is done on a state by state basis. Board of Nursing protects the public's health and welfare by assuring that safe and competent nursing care is provided by licensed nurses, and this is done on a state by state basis. Think about your state Board of Nursing. One more time. The Board of Nursing protects the public's health and welfare by assuring that safe and competent nursing care is provided by licensed nurses, and this is done on a state by state basis. Now, the State Nursing Practice Act is a law that defines the responsibility of the nurse's scope of practice, and this is also done on a state by state basis. Although that the Nursing Practice Act is typically the same on for all of us as nurses, but there's small variances state by state that can be applied, right? So, State Nursing Practice Act is a law that is defining the responsibility of the nurse's scope of practice, and this is on a state by state basis. And then one more time, the State Nursing Practice Act is a law that defines the responsibility of the nurse's scope of practice, and this is on a state by state basis. Whereas the standards of practice are the standards of the nursing practice developed by the ANA, the American Nurses Association, and they provide those guidelines for the nurse's performance. So the way that differs from State Nursing Practice Act, the State Nursing Practice Act is our scope of practice, the laws and responsibilities of our scope of practice, and there can be state by state variances. Whereas the standards of practice is a fully developed guideline of how all nurses should perform, and this is under that umbrella of the American Nurses Association. There's no state variances on this, okay? So again, standards of practice is developed by the ANA, and it provides guidelines for nursing performance. All right, next. I told you I want y'all to know certification versus licensure. I know, you know this. I know. But when you see it on a question or a exam or what have you, I need you to really be able to identify those keywords that can trip you up. So certifications, the this is where a non-governmental agency validates that you have met the criteria by meeting certain qualifications to receive the certification. So you have met certain qualifying standards for the non-governmental agency to validate that you should receive the certification. So those non-governmental agencies are like your ANCC, your AANP for nurse practitioners, right? So again, certifications are provided by non-governmental agencies that validate that you have met the qualifying criteria, right? Certification is provided by non-governmental agencies that validate that you have met the qualifying criteria. Now, this differs from licensure, right? because licensures um, define that you have met the requirements of the scope of that nursing practice to receive licensure by the state governmental agency, like your state board of nursing. So licensures are granted by state governmental agencies, whereas certifications are granted by non-governmental agencies, right? So again, licensure are provided after you have met the requirements of the scope of practice and is granted by a state governmental agency. One more time, licensure is provided once you have met the requirements of the scope of practice and is granted by a state governmental agency. Next, so I tell you to make sure you know consultation versus collaboration. These are another group of terms that kind of overlap if you really think about it, but I need you to understand the difference. So consultation is when two people discuss and use their expert knowledge for the patient's improvement, right? So thinking of like if you're consulting in a specialty like pulmonology, cardiology, what have you. So consultation, when two people discuss and use expert knowledge for the patient's improvement. And one more time, consultation is when two people discuss and use expert knowledge for the patient's improvement. Now, collaboration is the action of working with someone to produce something. So, like nurse practitioners and physicians working together. So they're collaborating together to assist one patient. Consultation is reaching out to someone with an expert knowledge on something to improve the patient's care. So collaboration, the action of working with someone to produce something. Collaboration, the action of working with someone to produce something. Now, health belief model. The health belief model is a psychological model that attempts to explain and predict health behaviors. The health belief model is a psychological model that attempts to explain and predict health behaviors. Health belief model is a psychological model that attempts to explain and predict health behaviors. And I always give the smoking examples because the health belief model is simply saying if based on your belief is how they will be apt to change, right? So if a smoker believes that smoking can cause lung disease, they're more apt to quit smoking, right? But if the smoker believes, hey, this doesn't cause any harm to me, why would they stop? That's what all the health belief model is saying. Now, sensitivity versus specificity. Sensitivity and specificity are really just a way for tests to show whether someone has a disease or if they don't have the disease, right? So, sensitivity is the ability of a test to correctly identify those with the disease. So, positive findings, right? So, I say think positive like the plus sign. Think sensitivity has more T's in the word that it looks like a plus sign, right? So, sensitivity, the ability of a test to correctly identify those with the disease. One more time, sensitivity is the ability of a test to correctly identify those with the disease. All right, now specificity is more specific. It's the ability of the test to correctly identify those without the disease, so the negative, right? So, specificity, the ability of the test to correctly identify those without the disease. And one more time, specificity is the ability of the test to correctly identify those without the disease. Now, leadership and leadership styles. I'm not going to get too heavy into leadership. I went over it in the other video, but I do just want to tell y'all, remembering to review that collaboration and consultation, understanding that if you are leading others, there will be conflict resolution. So, understanding negotiation and mediation, where negotiation is finding resolution between two parties, and mediation is requiring a third party or entity to help come with a resolution between two other parties, but also that there are changes and when you're dealing with anything. But as a leader, you have to be able to work to strive for positive changes, right? So including those in those change decisions helps with positive change. So, for example, like if I come into the office and I'm telling you guys, like, look, I'm about to take all this furniture out of here. It's got to go. And you're like, oh, girl, wait, like, why are we moving all the furniture? I like that chair. But if I come in and I'm like, hey guys, look, we're getting more people. So to accommodate the numbers that we're going to have to switch out this furniture. I don't know if you like particular styles, or if some of these that you found that you didn't even like what that we had previously, if you can give me any of your input and feedback before we make this decision, you're more apt to change, because you're like, oh, okay, yeah, this is why we made this. This is why we're doing these changes. And you're included, right? You would more positively change that way versus I'm just coming in here and just making decisions and doing stuff and don't even take anybody else into account, right? But there are three leadership styles that I want to talk to you about, which is authoritarian, democratic, and the laissez-faire. So authoritarian is where the groups are controlled and discussions and decisions start from the top and they work their way down the chain of command. So think authority, right? So authoritarian decisions are starting at the top and it works their way down the chain of command. Groups are controlled. One more time, authoritarian, the groups are controlled, the decisions start at the top, and then they work their way down the chain of command. Whereas democratic leadership style is a style where decisions are made within the group. It's more of a team approach. Democratic, the decisions are made within the group. It's more of a team approach. Democratic, decisions are made within the group. It's more of a team approach. And then lastly, laissez-faire. This style lacks control and doesn't have any direction. Um, they have a better response and effort, but there's no structure. So I say laissez-faire looks like lackadaisical to me. I don't know why, but laissez-faire in my mind looks real lax. So think is relaxed. There's no structure, there's no control. We're just doing this. People respond better to it because we're just going with the flow, but there's no structure to this, okay? Laissez-faire lacks control and does not have direction. Now, in the original video, I put the slide here because I was going over other terms with you guys just to kind of to throw those out there. Advocacy I talked about, so I'm not going to spend too much time. I just want to throw it back out there to you. Advocacy, is in healthcare. That's our role. We advocate for our patients and families, right? And then emancipated minor, I talked about that as well. Just remembering that emancipated minor are people under the age of 18 that don't require an adult consent. And those are the people who are less than 18, but they're in the military, or less than 18 and already married. That's considered emancipated minor. And then I went over, like primary, secondary, and tertiary prevention. Remembering primary prevention is those preventative measures, secondary prevention is screenings, and tertiary prevention is your treatment. Now, with anything that you are struggling with, go back into that previous video where I spent a little bit more time. Again, these videos are utilized to try to help you get that repetition style of studying. Repetition is the key to retention, right? I tell you that over and over and over. So we're just strengthening that muscle. And I was telling you guys about the flashcard sheets that I was mentioning, just to spend some time on those, right? So as you're writing these 3 times, one of those 3 times can be for your flashcard sheet, treating it just like a flashcard. I'm big on the sheets to help incorporate in our busy schedules with studying, and just simply the terms, write all the words on the front, write the answers, the definition on the back. Hang it on your closet door, your bathroom door, your refrigerator. And every time you go to those areas frequently in your home, test your knowledge. Make yourself do it. If you get stuck, you don't remember, flip it over, look at the answer. But this is engaging and studying, even in the midst of doing your normal day to day, right? Now, you guys, again, this concludes our non-clinical series. If you haven't had a moment, go check out all the stuff that we covered for the past 4 weeks. Every week that on Tuesdays, we did our topics and tips, and we worked through all of these terms in the non-clinical section. Wednesdays, we worked out our practice question for our Work It Out Wednesday. And then our Thursday for this series this month, I did the repetition for retention, right? And so take a moment if you haven't had a chance to study it. But next month, we're going all in. We're doing practice questions. It won't just be just Wednesdays only. We're working it out all month long. We've been hitting this content and getting that foundational knowledge on board for some time now. So let's apply this stuff to the test questions and do some practice questions so I can make sure that you are understanding AAMP versus ANCC and getting yourself structured and prepared to go out here and be successful on boards, right? So make sure you guys like, comment, and subscribe. As always, thanks for watching. Be sure to share with someone whom you may feel that may find this beneficial as well. But be sure you meet me back here. Bye, y'all.